Hi everyone. This is a high-level topics about biostatistics and epidemiology. Discuss the sensitivity, positivity of a test. Usually, it is a repeated question in NBME and in the exam. I made this video because, or I will make this video because I had a wrong question in recent Ammar self-assessment for Step 2 CK. So I decided to do this video and never to get wrong anymore. So usually this is the diagram when you have a question, talk about some test, for example cancer antigen test for diagnosis of pancreatic cancer. Usually the threshold for diagnosis, for example, 40 units per mol. If the threshold for diagnosis or cutoff value for diagnosis lowered, so this will lead to which of the following? This is the typical question. So on the question, either they said an increased positive predictive value, an increased sensitivity, decreased specificity, an increased false negative result, decreased false positive result, and so on. So how to solve this question? So usually draw a diagram like that, and on the left side we put the normal individuals, and on the right side put the disease individuals. Usually the normal is a true negative value, because since they don't have the disease, whereas the disease is the true positive value. Okay, this line in the midline, this is for the high sensitivity and the high specificity of the test. So if we either go to the right or to the left, one of them will be decreased and the other will increase. But in the midline, the test has high sensitivity and specificity. So as we said, on the left true negative value, and on the right is true positive value. These here, this and this one, the true negative or the normal that diagnosed as a positive in the test here. So this is the red line, and they become positive at the test. This is so this is considered as a false positive, because they are a normal individual but diagnosed as a positive in test, so false positive. Whereas these on the left side, these are the diseased individual, as we said. This is a diseased individual, and they become negative, appear negative on the test. So they considered as a false negative, since they have a disease but they appear normal or negative in the test. So usually the positive on the one side, and the on the right side, and the negative on the left side. True negative, false negative on the left, true positive, false positive on the right. So if in the example said that the cutoff value is lowered, like in this one, or the cutoff value is increased, as in this one. So let's first talk about when the cutoff is lowered. So this lead to, so when we lower the cutoff, this will lead to an increase. So this area, so mean that the true positive is increased, as shown. So increase the true positive. Also the false positive will increase. whereas the true negative and false negative will decrease true negative and decrease false negative. Since the true positive rate is equal to the sensitivity, so this leads to an increased sensitivity when we lower the cutoff value. And since the true negative is rate is equal to specificity, so this leads to decrease specificity when we lower the cutoff value. Also, sensitivity equal to the negative predictive value. So negative predictive value will increase. This is n and this is n. So this will lead to an increase in negative predictive value. And positive predictive value, since it is b, since specificity equal to the positive predictive value, so it will be decreased since the specificity is decreased. So this is occur when we lower the cutoff. If we increase the cutoff, in this example, this will lead to, or I must change the the drawing. So anyway, so if we increase the cutoff value, for example, we increase this cutoff, what will lead? This will lead to the following. So this area will increase. So if we on the side of the true negative, so this will, if we increase the cutoff, this will increase the true negative as well as increase the false negative. On the opposite of when we lower the cutoff and decrease. So this little area is this little area for the false positive. So this lead to decrease true positive. I'm sorry, and decrease the false positive on the opposite, as we said. Since the true negative, as we said, true negative is equal to the specificity, so this will increase the specificity and also increase the positive predictive value. Since the true positive is equal to sensitivity, this will lead to decreased sensitivity and decrease negative predictive value. So any question, if you face it on any self-assessment or exam, you will solve it by this method. And thank you.